Welcome, everyone. The title of today's webinar is Gender Dysphoria and Autism Spectrum Disorders, a Scientific Discussion. My name is Andrea Domitic, and I am the Director of Development for R.E.A.C.T for Hope. My co-host is Maya Hahn, and she is the President of R.E.A.C.T for Hope. Thank you for joining our one-hour discussion.
Hi, Andrea and everybody. Thank you for being on. So there is a high prevalence of gender dysphoria among autistic individuals. So we are here to discuss this subject, contributing factors and outcomes. And as you can see, we have multiple speakers. Each speaker will be introduced and given 5 to 7 minutes to present their topic. Once all have presented, we will have the opportunity for some final thoughts.
I want all the participants and people who are listening in and watching this to understand that there's not a single person on this call that has ill will towards anyone who is dealing with gender issues or gender identity or gender dysphoria, or who knows that they're male in a female body or anything like that at all. Our agenda is to make sure that people are as healthy as they can be.
So let's begin.
Okay, our first presenter is Stephanie Coxon-Hunt, Ph.D. Stephanie sits on the steering committee for PCI Consent PA and Right-Minded Women, and is a contributing writer for America Out Loud and more. She will answer an important question. What are top contributors to the rise in gender dysphoria in the population? Stephanie, please share your findings with us.
Yeah, so I would say this is a very complicated issue, and you really have to address both physical and social influences, because I don't think it's simple. And I also want to say that there's so many confounding issues that the research is not great in this area, but you can certainly extrapolate a lot from what is in the research. I just want to kind of throw that out there as I go through this. Because really what we're looking at is a host of endocrine disruptors and inflammatory issues right off the bat. So, before a child is even born, they are already having hormonal issues passed down through the fetus. And so I want to address the why of some of that for people who may not understand that. Within my practice, I see a lot of people who think they're not exposed to toxins at all, and that it's not having an impact on their body. And so I think a lot of people just don't know. So when we're looking at those things, I want to address things like phthalates, atrazine, heavy metals, fluoride, plastics, PFAS, vaccines, foods, and then just some of the gender affirming care and psychological influences, and just kind of highlight a few of those, because we certainly can't get into all of them in depth in such a short period of time. But whenever I'm talking to people about these things that are disrupting the endocrine system or the hormones, one of the things that is kind of known as the everywhere chemical, let's say, is phthalates. And this is something that is found in fragrances, plastics, things like that. They're known to really impact the endocrine system. They're known to inflame the system, and they're found everywhere. So I want you to think about candles, plugins, almost everywhere you go. When you walk down the detergent aisle, when you're picking up soap, shampoos, they're highly influencing what's happening. And what people don't recognize is, again, this is starting in the fetus. So this is starting, you're seeing lowering testosterone developmentally within the male fetuses. So it's before you're even impacted, and it happens generationally. And so when we take a look at phthalates, there's a myriad of them. A lot of people might be familiar with like dibutyl phthalates, probably a more common one, or its metabolites, but they're associated with these altered hormone levels. And in Korean studies, it's shown that they are altering those hormone levels in very young age, and therefore they're really, a lot of doctors are beginning to say, we need to ban these. We need to get these out of things. Another one that's really interesting that I think is just starting to kind of catch on is an herbicide. So our foods are also very toxic for our systems, and again, in the same sort of a way with the endocrine system. So you have something called atrazine, which is an herbicide that's used agriculturally. Oftentimes you're finding it in corn and sorghum crops. It's the most commonly used, and it's the biggest contaminant within your surface water, your groundwater, and it interferes with both estrogen and testosterone. This is one that is actually shown to convert male frogs into female frogs. Not every single one, but a portion of them. So, just those two things that you may not even realize walking into your grocery store that you're getting, purchasing your foods. And then we get into something that a lot of people don't associate with this that I think is important, and that's fluoride. I think there's a effort to get more information out there, but I don't know that people really understand what's happening with the fluoride, how it impacts the endocrine system. It impacts the pineal gland specifically, and interferes with hormones because it pulls calcium and then from the bones, and then it calcifies the pineal gland. And this is something that's very photosensitive. So we need this gland in order to in order to help our something called our circadian rhythm, and that's what helps our like sleep cycles. It helps with it gives the secretion of melatonin, for example. And one of the things that we know is that patients that exhibit neurodegenerative diseases, such as autism or even depression, tend to have abnormal melatonin rhythms. And so that's something that we want to pay attention to, because that's very common. And when you're dealing with that inflamed system already, when you're dealing with depression, we're not able to really make good decisions, right? And I think that leads into the social aspect. If we further kind of go down the plastics, so we move more into the plastics, I think it's important for people to realize that again, that parental exposure does affect the children's neurodevelopment and neurobehavioral outcomes. And I'll be happy to post like a bunch of studies for people to read about this. But the polyvinyl chloride was developed early in the 1900s, but really did not start to be widely used until after World War II. There was about a 300% increase from 1926 until after World War II, and they started to become in use. Now 70% of our food comes in plastic, 50% of our beverages. It's also in most of our carpets. And so it's absolutely everywhere. But this is what I think shocks most people, is that several studies have shown that there's 10,000 microplastic particles present in just one bottle of water, for instance, right? And how many of us are carrying like bottles of water trying to stay hydrated? So this is a pretty big ordeal. So all plastic containers will emit nano and microplastics that lead not only to endocrine type diseases, such as endometriosis, but also neurological disorders. Cancer is one, obesity, diabetes, all of those sorts of things. So the sum of this is that we are ingesting about a credit card's worth of plastic each week, each one of us, if you're a standard American. So it's a little shocking for people. What's even more shocking is that within 2 hours of ingestion, the plastic particles can then be found in your brain. So I think that there's a big impact. Another one that I think probably most of your listeners will be familiar with is some of the vaccine issues. One of the study out of 2014 from the Journal of Public Health and Epidemiology showed that there's a significant correlation, for example, between the autism disorder, the MMR, the varicella, and the Hep A vaccines. Those vaccines specifically deal with DNA fragments. So the FDA has known for years that the dangers of insertional immunogenesis, which is like that creation of mutations within the DNA, that is caused by the human fetal cell lines that are being used, and they've ignored this. So we're dealing with an already inflamed brain. We're already dealing with hormones, right out of the gate, just by living everyday life in the United States. And now we bring in social and authoritative influences, right? So humans want to belong. So I think what we're seeing is we're not actually caring for what the problems are. And instead, we're guiding them down a very dangerous path.
Okay, our next speaker, Dr. James Lyons-Weiler, also known as Dr. Jack, is a scientist, medical journal editor, and founder of IPAK Edu. He will present on the science of EDCs, autoimmunity, and gender dysphoria. Can you please tell us about this, Dr. Jack?
Yeah, so there's a few things that we'll be discussing in greater detail later on, and I want to start at the high level here for my little segment, because, there are mad people in places of power and authority who have decided without any science whatsoever to inject into the thought stream of our children that they should transition without the parental consent in some cases, in some states, without understanding what the outcomes are, as Dr. Coxon Hunt mentioned. And I want everybody to just consider the following. The European Union decided that it was going to be best and most humane to start transitioning individuals before puberty. And given the disaster that that led to with hormone treatment therapies and gender affirmation, they have abandoned that in the European Union. They no longer will give any medical intervention to a minor who has not gone through puberty. And so these kinds of uncontrolled experiments have dramatic, as we've all seen, sociological and psychological consequences, which I'm really happy that Dr. Mark McDonald decided to join us here because he has great insights on that. You know, I teach the course Environmental Toxicology at IPAK Edu, and I have 2 lectures that are freely available. One is the opening overview lecture. The second one, because I thought it was so important, was the EDCs. Our species depends on reproductive effort of people to replace people. The very health of our species as a whole really depends on the health of our reproductive ability. And that depends on a lot of things. You know, we've all seen global sperm counts decrease for the same chemicals that Dr. Coxon was talking about. There is there's a laundry list of chemicals that we can go over. We don't need to do that. What we need to do is we need to say that the people that have been in charge for the past 30 years at the NIH and the people who are making decisions about funding for important organizations like the NIEHS, which was completely defunded for all intents and purposes for addressing the issues of the effects of chemical exposures on development, immunodevelopment, neurodevelopment, and sexual development. We have a big problem with embedded apathy through regulatory capture, specifically aimed at making sure that American corporations maximize their profits. You know, the really bad news, there's not just a laundry list. In my deep dive on environmental toxicology in the course, I uncovered that the American chemical industry and the chemical industry worldwide produces 400,000 new chemicals a day. So we can list all the chemicals, you know, and I've done it. It's not fun. It's kind of depressing. You can list all the chemicals and their sources. The question is, how in the world do we get out of this mess? And so, you know, for the well-being of the individual, well-being of the family, well-being of society, we have to take an accounting of how serious we are taking environmental toxins as a whole. You know, the fact is, we can't do this by making sure people have a low dose because there's too many. We don't know their synergistic toxicity. These are hormone mimics. You look at the molecular structure of the chemicals. They look like estrogen. They look like testosterone, or they're precursors, or they actually block hormones. They don't have to be active hormone-like. They can be antagonists. And so, you know, the concern really is at a programmatic level, at a very high level. Are we taking this serious in any real and meaningful way? And the sad answer is no. We don't have a sufficiently interested NIH or EPA. I mean, the fact that the EPA has to be sued, right, to actually take action on chemicals that we know are causing cancer, that we know are causing harm, that we know are disrupting hormonal development and the endocrine system, it's a travesty. It's a real travesty. So, you know, I'm a conclusions guy. I'm a problem solving guy. I want to know what the answer is, and I think the answer is going to be that the people have to hold the people who have not done their jobs accountable. There's no accountability. There needs to be higher transparency, obviously. And just in the short minute that I have left here, the fact is, there's a huge amount of literature that I'll come back to at the end. A huge amount of literature. NIH, EHS, and other funding organizations have funded the research to tell us that these are a problem. The problem is that the leadership, like Francis Collins, who's now gone, and of course Anthony Fauci will never say anything about this, but the CDC, has not recognized this as a public health emergency. Instead, they want to wave rainbow flags. They want to tell people that everything's acceptable and everybody's beautiful just the way that they are. But it's really hard to say that everybody's beautiful just the way that they are when there's so much regret that's been reported by people who have transitioned before or around puberty and haven't waited until their prefrontal cortex has sufficiently developed to determine who the hell they are in this world. And so the fact that the state, the last thing that I want to say is the fact that the state is using this and other issues to inject themselves right between the parent and the child means that you want as less involvement, as little involvement of the state. And I mean, not just the state of California, any state, the government between you and your child, that needs to be minimized at all costs. And I mean that in every respect. We only have one chance in our legacy. The most important priority to us is our children, individually and collectively. And so, with all the love in my heart that I have for humanity, I want to see real change and I want to see solutions. And so, thanks for hosting us.
Very well said. Thank you, Dr. Jack. Our next speaker is Dr. Christina Parks. She received her Ph.D. in cellular and molecular biology from the University of Michigan. Dr. Parks will discuss the disruption of the HPA axis by both endocrine disruptors to begin with, and then by hormone treatments and surgeries. Dr. Parks, can you please explain this?
So I want to start out at a very basic level. We've been acting like if you change your hormones, you change your gender, but gender is actually not determined by the presence of a penis or the lack thereof. It is determined by the presence of the X chromosome. And so the X chromosome is actually not as well understood as we would like, but one of the things that it is suggested to do is actually play a role in the formatting of other genes. So when you are in utero, it's not just that the, did I say X chromosome? The presence of the Y chromosome? That's what I meant. The presence of the Y chromosome makes you a male. In the female, you can have one X, you can have two X's, you could even have three X's, which is not good. Either one or three are not good. Two is normal. But if you have a Y, you are male. And that Y chromosome is going to help to format the rest of your DNA, both when you are in utero and again during puberty. And so it's actually going to format your DNA in a way that it responds to hormones differently. Males and females respond to both male and female hormones differently than each other. They also, and this is really important, respond to stress hormones differently, both at the genetic level and because women do have different circulating hormones that change during the month. So again, it's not your organ that determines your sex, it is your genetic makeup. And when your DNA is formatted that way, again, it's going to produce different hormones, but it's also going to respond differently. So in the developing fetus, your anatomical structures are actually different. And I'm not just talking about your organs. We're talking about the size of certain nerves, the way that they're integrated, the very way that the brain structure is made and integrated. Now, as Dr. Coxon has said, basically because we have all these hormone disruptors and all these chemicals, that may be being disrupted during infant development because we have endocrine, we have, estrogen-like compounds that are really active. And we know that even birth control, when people pee, they pee and then it goes to water treatment, but it doesn't take out all the estrogens. So we're drinking more estrogens. Our babies are exposed to more estrogen-like compounds, and that likely affects their, actually the formatting of their DNA and their brain development and the development of other things. So yes, this starts probably in utero, this problem. I do just want to touch on some of what Dr. Coxon said about, all of the different pleiotropic things that are contributing, because I think one other thing that's contributing greatly is the microbiome. And because you make many of your neurotransmitters that control or influence how you think in your microbiome, the disruption of the microbiome by all of these different toxins, by vaccines, by low-grade infections with like MMR, measles, mumps, rubella, all live viral vaccines, can influence the cognitive state and the emotional state of our children and our adolescents as well. But I do want to talk about the hypothalamic pituitary axis as well. So what happens is all of your hormones are sort of made, like most of them are made by cholesterol. They're made in many similar metabolic processes. And so when they're made, they all both interact with each other, and many of them are substrates for one another. And so it's a very complex process, and you can't just take some out and add some and think that it's only a one-to-one thing, like you add this hormone, it's going to make you make boobs. No, it's going to also affect the way you make your stress hormones. It's also going to feed back to your hypothalamus and influence the way that you secrete every major hormone and signaling molecule in your body. It's going to completely, I would say, not regulate, but dysregulate every hormonal axis in your body. And the reason this is because your DNA is programmed to respond to hormones in a certain way. And all of your hormones are like an intricate symphony. And if you just come in and decide everyone's going to blow tubas, this is not going to work. Okay. It disrupts everything else. And so one of the key things is your stress response. We know that when you disrupt the hypothalamic pituitary axis, you completely disrupt the way your body responds to stress hormones. And that is actually disrupting that axis and disrupting your stress hormones is actually really, really highly correlated with neurological dysfunction and with psychiatric problems. So it's very, very highly correlated. So when you are not processing your stress hormones correctly, and when your other hormone systems are out of whack, you're going to have mental problems. And so what are we doing? We just think that we're just going to have this one size fits all answer, and we're just pretending. We're pretending. So the problem is there. The problem is complex, which we've all discussed in terms of what is affecting our children in all these different ways. But to pretend that there is this pie in the sky solution that is going to solve all our children's problems is actually criminal abuse of our children, because we are letting them believe this as well. And there is no real way that that is ever going to solve any of the problems, whether they're biological or psychological.
Thank you, Dr. Parks. Now that we have some background on the factors contributing to the development of gender dysphoria, we can delve into the transgender medicine. Dr. Peter McCullough is a practicing internist, cardiologist, and epidemiologist in Dallas, Texas. He will present on the safety outcomes of transgender medicine. Feel free to begin.
Well, thanks for having me. I'm Dr. Peter McCullough. I'm a practicing internist and cardiologist in Dallas, Texas. And throughout my career, I've taken care of and cared for gender diverse populations, including transgender adults. These are my observations and analysis on the current state. We're told that potentially 20% of high school seniors could undergo a gender journey. That is a boy attempting to become a girl or a girl becoming a boy. And what I know about this is that the hormones utilized to do this prior to puberty, largely with a medicine called Lupron, and then after puberty, androgens or estrogens, in a paper by Santos and colleagues, makes the kids sick in the majority of the time. They get headaches, abdominal pain, acne, sleep disturbance, weight gain, because it's very unnatural to administer gonadotropin releasing hormone agonists and androgens and estrogens to a normal person. And so that's greatly concerning. After about a month, these hormones start to cause permanent changes in the voice and so many other aspects of the human body. The surgical results are very, very disturbing. Mastectomy in normal girls includes complete removal of all the fat tissue down to the pectoralis muscle, it almost always results in contractures because the girls are still growing. And then the surgeries for the female genitalia, something called phalloplasty, that is creation of a false penis from a large amount of flesh from the forearm or the thigh, results in disfigurement of the extremity. And then an appendage that isn't sexually functional, urine has difficulty draining, infection rates are high. Procedures to enlarge the clitoris called metoidioplasty also result in a non-functional sexual organ, difficulty in urinary drainage. Infection rates and revisions are high. Some studies suggest the revision rates on these surgeries are 30 to 50%, and so the outcomes there are poor. But it's greatly concerning about what's happening on clinical outcomes. So the indication for all of this is gender dysphoria. We'll hear about this from other experts. But what I can tell you is that in a paper published in Sexual Medicine, the rates of psychiatric visits and the burden of psychiatric disease worsens after the transgender journey, the clinical care, as opposed to improves. We have data from the UK published in JAMA demonstrating that the transgender journey, again, transgender medicine, results in higher rates of homicide, suicide, and death from other causes. What we've heard from prior speakers is that this is all in the context of an epidemic of autism, and now multiple papers suggest that young people coming forward for transgender change are very likely to have autism or autistic traits. And it makes sense that a psychologically normal child is going to be very unlikely to try to navigate this or even be convinced to do it with as much indoctrination that exists in the schools. A child from a normal family with proper gender affirmation during childhood, very unlikely to do this. However, an autistic child many times feels ostracized, is suggestible, and then could be induced to go down this gender journey. So to summarize, transgender medicine is linked to the epidemic rise in autism, in that we have clear and compelling data that transgender medicine results in making the children sick, increases the burden of psychiatric disease, and raises the risk of death from homicide, suicide, and other causes. I've stated publicly that no ethical doctor, nurse, or technician would ever participate in a transgender medicine program with these outcomes for the youth. And many courts agree now. Transgender medicine has been banned in Texas for about 60 days now. We're talking about transgender medicine for the youth. I think an adult who wants to live out a fantasy as a member of an opposite sex is perfectly fine. There's always been a diversity of sexual preference that's existed for centuries. But it's clear now, based on this analysis, that transgender medicine is bad medicine for our youth, and it's appropriate if doctors, nurses, and medical centers can't make the right ethical choices in terms of this form of medicine, that the states will step in some cases, countries step in and ban transgender medicine, both the hormonal aspects and the surgical aspects of it. I'm Dr. Peter McCullough. Thank you so much for having me.
Thank you, doctor. And now our final two presenters will enter into the psychological science related to gender dysphoria. Dr. Miriam Grossman is a child and adolescent psychiatrist whose practice consists of trans-identified youths and their families. She is the author of the book Lost in Trans Nation. Please share with us the dangers of encouraging children with gender dysphoria to socially transition in school.
Well, thanks very, very much. I want to just begin by saying that we are living through a period of mass psychosis right now. And that psychosis consists of denying biological reality, believing that biology doesn't matter, that feelings override reality. Basically, it's a psychosis in which disembodiment is being celebrated. Now, as adults, we have the responsibility of living in reality. An emotionally healthy person lives in reality, even though it may be very painful. But if you are emotionally healthy, you live and accept that reality. Now, we do no favor to children by denying the reality of their biology. We do no favor to them by quote unquote affirming this a new persona, a false persona that they have been convinced is going to be the solution to their problems. And so people are paying a very high price for this mass psychosis and for this denial of biology. Now, in terms of social quote unquote transition at school, which is what you asked me to comment on, when that happens, the school is agreeing with the child that they were born in the wrong body. Now, that is medically and scientifically impossible. There is no foundation to such an idea. And when we go along with the child's request to be called by an opposite sex name, pronouns, to use the bathrooms of the opposite sex, the changing rooms of the opposite sex, we are, if in permitting that, we are affirming the child's false belief that they are the opposite sex. That is not a favor to them. They will never be able to be the opposite sex. It is impossible. So even though the child may experience some short-term improvement of their mood, in the long term, they're not doing them a favor. Now, next, by socially transitioning, we are cementing this false identity. We have studies, 11 studies, that show that most kids, if they are allowed to go through their natural organic puberty, they will desist. They will get to a point as young adults in which they are comfortable with their bodies. But if we encourage them to go through so-called social transitioning, we are causing what's been called an iatrogenic persistence. So the doctors, the therapists, and other adults in the child's life are causing persistence when otherwise they may have desisted from this false identity. That is a very, very big deal. We don't want our kids going down a path that leads toward these experimental, harmful, lifelong disfiguring and sterilizing medical and surgical interventions. And we have evidence that social affirmation, social transitioning will do that. It will cement the false identity. Next, when schools encourage one identity at home and another identity at school, they place a big fat wedge between the child and his or her parents. To live a life as the opposite sex is life altering. It is the biggest decision that a person can make. And when that becomes a secret that is kept from the family, it gives the child a message that the school knows better than the parents what's good for the child, that it's the school that cares more about the child than his or her parents. It creates erosion of the child-parent bond. And this is an awful thing. Aside from the very rare instances in which parents may be neglectful or abusive, most parents want what's best for their child. Most parents know their children better than the teachers and the principal and the guidance counselors. So what schools are doing when they are keeping the secret from the parents is eroding the most important relationship that the child has at that time with their families. And finally, I want to mention something called the Stroop effect, STROOP. The Stroop effect refers to a phenomenon in which if there is a stimulus that is mismatched, your brain, it's going to affect your brain functioning. What do I mean by that? Let's say you're reading the word red, but it's printed in green. So it says red, R-E-D, but it's the color of the letters is green. Now, your brain is going to find it more difficult, and it's going to take a little bit more time to read that word because there's this mismatch, there's this incongruence between what you're seeing and what you know to be. And this is what happens when we are forced, and in schools, of course, the other students and teachers are forced to consider a child to be the opposite sex. And this may have been a child that, you know, they've known for many, many years. They may have known, you know, since preschool, since kindergarten. Suddenly they're in 6th grade, 7th grade, 8th grade. They come back from summer break and they are no longer a girl. They are supposed to be considered a boy. Everyone's supposed to use the male name and male pronouns. This is setting people up, especially kids whose brains are still developing. They may be neurodivergent. They may have ADHD or all sorts of other issues, autism, obviously. And so they are going to be prone to making mistakes. And as your audience knows, I'm sure, misgendering and dead naming, in other words, using you know, the proper name and pronouns that are associated with the person's biological sex, that is a big sin these days. And you're going to be socially, you're going to be punished, and you're going to be maybe even ostracized for continuously making that mistake. Even though this may be a peer, another student that you've known for many, many years, and from one day to the next, you are expected to make this change. It's certainly true for other adults in the kid's life, grandparents who may already have some cognitive issues, may also have difficulty due to the Stroop effect, even if they have good intentions. And I think this is an important thing to know about. So I'm going to stop with that, and I'm sure that Dr. McDonald is going to cover some great material.
Thank you, Dr. Grossman. Lastly, I'd like to introduce Dr. Mark McDonald. Dr. Mark McDonald graduated from UC Berkeley before attending medical school at the Medical College of Wisconsin. Trained in both adult and child and adolescent psychiatry at UCLA, he now works primarily with children in a private practice in West Los Angeles. Dr. McDonald will present on the victimization of autistic kids by the transgender movement, as autistic kids are more susceptible to its seduction than others. Please begin.
Gender dysphoria is a psychological or mental illness. It is not a physical illness. Therefore, treatment should be psychological and not physical. I think this, above all else, is something that we must recognize as clinicians so that we can put a stop to the abuse of children, which is what the transgender movement and transgender medicine has done. Autistic children specifically are incredibly vulnerable to what Abigail Shrier wrote in her book, Irreversible Damage, to the transgender attack on young people. And the reason for this is autistic kids find it very difficult to find community because they have a deficit in social mirroring. And they find it very difficult to bond and to become one with a group. Transgender ideology and the transgender cult has victimized primarily young girls up to now who go through adolescence, which is natural, and find it difficult to go from girl to woman, which is also natural. And they provide a shortcut, basically a cheat, so that young girls can avoid the difficulties and the suffering of changing bodies and changing development and simply jump into an identity group called the transgender group. Autistic kids are also equally victimized because they go through this for the rest of their lives. They're not transitioning from boy to man, girl to woman. They are autistic, and that means that they are permanently at a deficit for finding belonging in the human world. I agree with Dr. McCullough that it is a travesty and it is medically unethical and should be illegal for clinicians, physicians, and surgeons to practice genital mutilation and puberty blocking and sterilization, which is all a form of child abuse on young people under the guise of transgender ideology or transgender inclusion or affirming care. However, I would go a bit further. I would say that all transgender medicine should be banned, should be made illegal, and should subject the practitioner to stripping of licensure and imprisonment at any age. And the reason for this is simple. Why, if we are not comfortable sacrificing our children to a transgender cult in the way that the Incans, the Mayans, and the Aztecs did, by slitting the throats of children and throwing women downstairs in order to appease the nature gods, why are we, if we're not comfortable with doing that to children, why are we comfortable with doing that to adults or to the elderly? A human being of any age has the right to receive ethical medical care, and that is first, do no harm. Any clinician that violates that adage is violating his oath of professional medical practice and medicine, and that also includes therapists. There is no medical justification whatsoever to remove healthy breasts, penises, vaginas, or inject hormones into a human being who is suffering from a psychological or mental illness, whether that is a 5-year-old, a 15-year-old, or a 50-year-old. So I think we should expand our outrage, our professional censure, and our disgust morally with any clinician who practices this form of sacrificial offering on any human being of any age. And that should include all people, because if it's immoral to touch a child like this, it's immoral to touch an adult. Obviously, children are the most vulnerable. So are autistic kids and adults of any age. So are young girls. But I am appalled that there has not been more outrage among ethical clinicians and medical practitioners to stop this and to end all transgenderism in the medical profession for once and for all. This is not a medical problem. This is a psychological problem, and it needs to be done with psychological treatment. When girls suffer from anorexia, we don't go in and encourage them to become more emaciated and to die of starvation. We encourage them to eat. When boys think they're girls or girls think they're boys, we shouldn't be cutting off breasts and penises and extracting vaginas. We should be fixing the mental health problem and treating them with the love and respect and care and ethics that they deserve.
Thank you, Dr. McDonald. Wow, thank you all for your presentations. It was filled with very critical information. And now we will circle back to each of you so you can share your final thoughts and also let people know where they can find more information about you and your research.
I'll just say that I think people need to be aware that brain studies have yet to show a distinct pattern that accounts for this atypical gender identity. And that's after statistically controlling for sexual orientation, exposure to exogenous hormones. So just, keep that in mind. Like this really is, a psychosis, and we've got to treat it like that. People can find some of my writings at americaoutloud.news, and I have a weekend show they can listen to called Twirl.
So I'd like to mention again the environmental toxicology course. It's important to not just understand the presence of toxins, but their dynamics, the dose effects, and so on. And many of them are counterintuitive. For instance, there's the concept of hormesis, where you have a nonlinear dose relationship. I said earlier, it's very difficult to just arm wave and say, oh, well, we're going to make sure everybody has a lower dose to these developmental altering chemicals. Sometimes a lower dose can be more effective. It really depends on the dynamic response curve there. And I would also like to say that, IPAK, the research institution, has been looking at the pediatric vaccine schedule, pathogen by pathogen, protein by protein, epitope by epitope, in search of parts of the proteins that are likely to induce autoimmunity in humans. If when I was doing proteomics, mass spec proteomics, there were 500,000 peptides in some of the samples that we studied. 500,000 peptides in the human body. I went through the vaccine schedule and I counted up, out of all the proteins that are in all the viruses and all the immunogenic epitopes that are present on all those viruses, I counted 500 different ways that the vaccine schedule can cause autoimmunity in humans. There's 500 opportunities against one protein, and now we have 500,000 epitopes. Listen, we're not abiding by our next generation or 7 generations or 20 generations down the line to say we're going to ignore the autoimmune component of autism, the autoimmune component of these gender issues. And it's cruel to keep people in ignorance and in the dark about what's happening medically to them. So I would defer to the psychologists here to say, yes, the manifestation of the experience of these gender confusion is psychological, but the impetus for it can be diet. The impetus for it can be environmental exposure. The impetus for it can be somewhat hardwired into an individual who had a different developmental trajectory. Just look at the diversity of phalli that are being produced right now in boys that are born. Just look at the diversity. There's a huge hormonal effect on the changes of what their phalluses look like. And so that research has to go on. We have to identify how and if vaccines are disrupting the endocrine system. And if they are, then we need to stop that practice too. And then finally, I'd like to announce, very exciting, that we're going to be creating a Wikipedia with R.E.A.C.T, specifically hosting this Wikipedia and database behind the Wikipedia of thousands of scientific articles summarized, expertly summarized, on the question of the effects of endocrine disrupting chemicals on humans. And so to the extent that you would like to support that, I would encourage Maya to speak for a minute on how people can best donate to R.E.A.C.T.
We'll do that. We'll speak on that here as the other doctors have completed their final thoughts. So Dr. Christina Parks, what would you like to end with?
Sure, and I'll just follow what Jack was saying, that we have disrupted ourselves, our children, society at every level biochemically. So make no mistake, there's some biochemical and probably structural basis for some of this, but our goal should always be to support the health of the body. And I have seen again and again, when you do that, people make remarkable gains and remarkable moves toward health. Secondarily, we keep saying that gender and biological sex are two separate things. Well, the thing is, you can be, a male who's somewhat effeminate. You can be a woman who's somewhat masculine. And that is by far more preferable than being someone who mutilates your body, not just physically in terms of gross anatomy, but biochemically at the very core level that's going to change the way you function forever. And so our goal should always be to optimize health. As a biochemist, let's optimize health first, and as well as deal with inherent psychological problems, and of course, societal issues such as allowing sort of cults of the way we identify these cults of identity to pop up.
Do you have anything you'd like to share as far as where viewers can find you, your information?
So in January, I'll be launching my website, vi-ta.org, and that's the Vaccine Injury Teaching Alliance. And so you'll probably see more about that. And that really deals with mechanisms of vaccine injury. And these underlying mechanisms are really core because they get to this core dysfunction at the biochemical level. And it's more really about chronic dysfunction in general, not just from vaccines, but it does focus on that as well. So thank you.
There's an epidemic of autism. When I was a child, it was 1 in 10,000. Now it's 1 in 36 today. The determinants of autism are not completely known, but the leading theories are that it's related to hypervaccination in childhood. That is, giving more and more vaccines at younger and younger ages in combination. There's over 200 studies showing that immune system dysregulation is associated with autism. The greatest, influence on the immune system during childhood is hypervaccination. Environmental toxins, many other factors could play a role. But I'm greatly concerned that the epidemic of autism is contributing to an epidemic of transgenderism, and that transgender medicine itself, it leads to harm. It's harmful during childhood. And I agree with it being banned in the youth. As adults make their sexual choices, I appear to be more moderate than others on the panel, that I think adults can make their choices. I do recognize it's a fantasy. So as a man who is likely bisexual or gay, wants to appear as a woman, that man, if he wants to, can dress up like a woman. That man, if he wants to pay for breast augmentation surgery, can do so. But in 2016, the Obama administration actually mandated coverage by commercial insurances and HHS for all gender transition care, including these surgeries. Likewise, if a woman wants to make a choice and live out a fantasy as a man, I think she can do that. The complicity of the medical community is where the controversy is. In there, the ethical care of individuals, I think, comes to where there's tension. And I understand Dr. McDonald's arguments there that above all, do no harm. And in the balance, medicine has so many challenges that transgender medicine on average causes harm, doesn't help in any case, and the world would be better off without transgender medicine. I'm Dr. Peter McCullough. You can follow me on my website, petermcculloughmd.com.
I have a website, which is miriamgrossmanmd.com. There's really a wealth of information there, videos, articles. You can see my testimony to Congress on this issue, in which I reminded them that sex is not assigned at birth. It is established permanently at conception, can never be changed. I urge parents to become educated and to be proactive. No family is immune. When your child comes home and announces that they are the opposite sex and they want to be placed on puberty blockers, that is a nuclear bomb going off in your home. You want to immunize your family against that. I have written the book, Lost in Trans Nation, a child psychiatrist's guide out of the madness. It's going to give you practical tools. It's not written for people with PhDs and MDs. It's written for regular moms and dads. How to talk to your child, how to immunize your family against these ideas, how to deal with schools, and much, much more. I actually did a survey of 500 parents who have or had at one point transgender identifying children. And I asked them, what advice would you give to families that might be going through this in the future? And I have responses from 500 families from 17 different countries. And I have that advice in the book. So parents, I'm urging you, be vigilant, be informed, protect your family.
I'm Dr. Mark McDonald. I go under the moniker Dissident MD now because offering a dissenting view makes one a dissident. My second most read Substack article in the last 2.5 years is titled Death, the Logical Endpoint of Transgenderism. I write frequently about transgenderism in my Substack, Dissident MD. And I also discuss it with Dr. Jeff Barkey in our podcast, Informed Dissent. We interviewed Dr. Grossman last year on our podcast, and it can be found at informeddissentmedia.com. You can also just search for Informed Dissent, the podcast, on Apple, Spotify, and other podcasting platforms. You can also track me, what I'm doing and where I'm speaking, like at the last conference recently in Florida, where I spoke about the attacks on children, on my Instagram page, which is also Dissident MD. So if you don't remember my name, just remember Dissident MD, search, find me, and you can read and listen to many of my thoughts, often controversial, always dissenting, on transgenderism in children and adults.
Dr. Mark McDonald also teaches a class at IPAK Edu called How Not to Be Fooled, which is an anti-propaganda vaccine.
Yes.
Very good. Well, thank you all for your time. And now Maya will have some closing thoughts for us.
Thank you all, doctors, scientists. It's really interesting to sit back and really listen to the different perspectives. I thought it was really nice to hear both the potential genetic and environmental, as well as the psychological, social aspects of that. I think that all of them are compounding points that our kids are faced with right now, especially those in the autism spectrum disorders. And I really appreciate all of your insights, your thoughts, and your continued analysis of this really, really important topic that is affecting our children at every level in our society. And I'm just really, really grateful that you guys are brave enough to speak out against the orthodoxy that was currently happening in our society and in our medical practices. So I think overall, you know, that we really do, all of us care about children. We care about people. We want them to be most informed and be prepared for all the repercussions that can come with this push towards transgenderism. And thank you for all of that insight. I think that this is just the beginning of people's journey as they watch this webinar. And thank you for where they can find more information. And I implore everyone that's watching this to go to those sites. We'll be posting them on our website, as well as in this webinar here. And I did think it was interesting, if you're not familiar with Dr. James Lyons-Weiler's book that was published in 2016, talking about genetic and the environmental aspects of autism. I think it transcends over into the transgender topic and all the things that we're facing with that. And with that, I want to thank you all for listening. Please support our efforts here at reactforhope.org. We are a nonprofit 501c3 with a mission to increase autism awareness, fund individual and family treatments, provide education, fund and support research, and develop treatment protocols for autism and other neurological disorders, developmental disorders, and chronic illnesses. Our board is comprised of doctors and scientists that are leading the way in research directly related to autism and more. The primary function of REACT is to be a support and resource for our growing group of people.
I wanted to say, one of the plans that we have is to do, you know, a multi-week, like 15-week series at IPAK Edu to generate revenue to help REACT for org. And so you're all invited as guest speakers to do a much longer version. And that's part of what this is to let people know that REACT for Hope is here on this issue, on other issues. So you're all invited as guest speakers on that. So we'll be in touch with you to do a deeper dive. And Miriam Grossman, Dr. Grossman, honored to meet you. Mark, good to see you, my friend. Stephanie, rock on. Dr. Parks, big hope. Let's go. We've got this.
Dr. McCullough, yeah, all of you guys, thank you so much. You guys are all incredible.
Recording. All right, guys. Thank you so much.
Bye.
Bye, guys.
Good night. Bye-bye.
And I'm Maya Han, President of R.E.A.C.T Research and Education for Autistic Children's Treatment. And I thank you for listening.